Good day. Today I would be speaking on the natural history of anthrax. So, anthrax is a disease that is caused by the bacteria Bacillus anthracis. It is found naturally in soil, and generally a person can become infected by breathing in its spores, consuming food or drink contaminated by its spores, or get spores in an open wound in the skin. There are four types of anthrax, and they are cutaneous, injection, inhalation, and gastrointestinal. So, stage of exposure. For cutaneous anthrax, a person becomes infected when anthrax spores gain access into an opening in the skin when a person handles infected or contaminated animal products such as wool, hides, or hair. For injection anthrax, a person can become infected by reusing contaminated needles. This is common among heroin injecting drug users in northern parts of Europe. Although it is similar to cutaneous anthrax and causes infection deep under the skin or in the muscle at injection sites. Inhalation anthrax. When a person breathes in anthrax spores, this is known as inhalation anthrax. Inhalation anthrax starts primarily in the lymph nodes in the chest before spreading throughout the body. It is the most deadly form of anthrax. Lastly, we have gastrointestinal anthrax, and a person becomes infected through raw or undercooked meat from an infected animal. Next, we're going to look at stages of infection. So we're going to look at symptoms. Symptoms are varied and depends on the type of infection. Cutaneous anthrax. For cutaneous anthrax, first a person will observe a group of itchy small blisters or bumps with a large amount of swelling around the sore. Painless sores are commonly found on the face, neck, arms, or hand, and it usually has a black center. For injection anthrax, infected sores, also known as abscesses, can be formed deep under the skin or the muscle. For inhalation anthrax, fever and chills, chest pain, cough or shortness of breath, heavy sweats, confusion or dizziness, nausea, vomiting or stomach pains, headache or body aches, along with extreme tiredness. For gastrointestinal anthrax, symptoms occur such as fever and chills, swelling of the neck or glands, diarrhea or bloody diarrhea, sore throat, hoarseness, and pain when swallowing, nausea, vomiting, especially bloody vomiting. Stage of infectious disease. For cutaneous anthrax, it usually develops 1 to 7 days after exposure, but its incubation period lasts up to 17 days. For gastrointestinal anthrax, 1 to 7 days after eating contaminated meat, and the incubation period usually lasts up to 16 days. Injection anthrax, 1 to 4 days after exposure, and inhalation anthrax develops within 1 week after exposure. However, the incubation period may be prolonged up to 2 months. For the prodromal period, most patients exhibit fever, chills, and fatigue. Stage of outcome. For cutaneous anthrax, without antibiotics, there is a greater than 2% chance of case fatality ratio. For injection anthrax, for inhalation anthrax, there has been an improvement in the case fatality ratio. So without treatment, there is about a 90% fatality ratio. That's the end of my presentation. Thank you.